Hello and welcome to my channel. My name is Jazzy RN. If you're new here, welcome. If you're not new here, welcome back. The goal of my channel is to help nurses pivot from the bedside to remote work. And a little bit of background about me. I have worked remotely in utilization review for over 9 years, and I've worked for 3 different major insurance companies. This company is Houston Methodist. They're hiring a denials management specialist. This job is remote and you must live in Florida, Georgia, Louisiana, Tennessee, or Texas. This job is full-time. I always go straight to the qualifications, and even if you don't meet every single qualification, I still suggest you apply. For education, you must have a Bachelor of Science. This is preferred. I'm guessing this is in nursing. They want 7 years clinical nursing or patient care experience with 5 years in utilization review, with clinical decision tools such as Interqual, Milliman, etc., case management or equivalent revenue cycle clinical role, including past experience in initiating and facilitating physician peer-to-peer review, medical or clinical denials and appeals, must have experience with prior authorization process for all providers, ordering and rendering. This job does hire LVNs. This is for State Department of Licensing. And also, I do want to mention once more, this is for nurses who live in Florida, Georgia, Louisiana, Tennessee, and Texas. Devoted Health is hiring for a bilingual English or Spanish and Spanish transitions of care RN case manager. Also, a transitions of care RN case manager that is not bilingual. I'm going to first start on the bilingual job. This job is full-time. You must have an unrestricted compact RN license, 3 to 4 years experience as an RN care management or telephonic case management experience, fully bilingual in English and Spanish. Your work hours are weekdays 10 a.m. to 6:30 p.m. Eastern Time or 10:30 a.m. to 7 p.m. Eastern Time. And they are looking for candidates who live in the Central, Mountain, or Pacific time zones. Salary is $85,000 to $100,000 per year. And for the non-bilingual job, this job is also full-time. Same requirements, compact RN license, 3 to 4 years experience of RN care management or telephonic case management experience. You'll work the weekdays from 10 a.m. to 6:30 p.m. Eastern Time or 10:30 a.m. to 7 p.m. Eastern Time. And they want candidates in the Central, Mountain, and Pacific time zones. MUSC, Medical University of South Carolina, is hiring a utilization management nurse too. This job is full-time. You must have a BSN in nursing from accredited school of nursing and 5 years nursing work experience, to include 2 years utilization or case management experience in a hospital setting. This is required. Prior leadership experience is preferred. Evidence of committee involvement within a healthcare setting needed. Must possess excellent verbal and written communication skills. Familiarity with Interqual and our MCG screening criteria desired. And this is desired, not required. I do want to mention, if you go to the description box below and you click on the link that says resume tips, that will bring you to a new page. If you scroll down to the bottom of that page, you'll see where you can go to get MCG or Interqual certification. This does not guarantee you the job, but it can make your resume more marketable. They also require you to have a RN license in the state of South Carolina or a compact state. Medical Director Services PC is hiring a nurse practitioner telemedicine. This job is $100,000 to $205,000 per year. You must have previous skilled nursing facility experience. They want you to be licensed in New York, New Jersey, Georgia, Texas, Pennsylvania, Alabama, and Missouri. You will work in the comfort of your home and service nursing homes throughout the United States. Once again, you must have skilled nursing experience as a nurse practitioner, and you will work 3 12-hour shifts that will be AM or PM. Adventist Health is hiring a RN quality assurance home health remote nurse. They prefer a bachelor's degree in nursing. Is not required, but it is required to have experience in home health, and you must be an RN. The pay for this job is $38.02 to $52.14. Concierge Home Care is hiring a virtual care nurse weekends. The salary is $20 to $22.25 per hour. This is for LPNs. You'll work from Friday to Sunday, 8 a.m. to 8 p.m. Your schedule includes every weekend. You'll work Friday, Saturday, and Sunday, hours 8 a.m. to 8 p.m., full 12-hour shifts, and this job is remote and virtual. I do want to mention here, you must have a Florida LPN license. That's required. Also, 2 years of home health experience is required. They want you to have a strong background in triage and hospital prevention. High risk or complex patients preferred. Telehealth technology and documentation systems. Proficiency in Microsoft Office is preferred. I do want to make sure you add platforms to your resume. That includes not just Microsoft Office. If you know Epic, Cerner, Meditech, Protouch, etc., whatever software or platforms you use at your current job and your previous jobs, you want to add that to your resume to make your resume more tech savvy. Utah nurse practitioners are hiring a remote psychiatric nurse practitioner. This job is 100% remote, outpatient psychiatric care. You must be a board certified psychiatric mental health nurse practitioner, active unrestricted license with autonomous practice authority, at least 4 years postgraduate clinical experience as a PMHNP, experience delivering outpatient psychiatric care that includes comprehensive psychiatric evaluations, treatment planning and medication management, psychoeducation and supportive therapy, and the annual on target earnings is $180,000 to $215,000 per year. Affect is hiring for 3 positions. These are all nurse practitioners. One is for Illinois, one is for Idaho, and the other is for Indiana. I'm going to only just focus on the Illinois position, and the other positions all have the same exact qualifications. This is a full-time and part-time opportunity in Illinois. You must have an active verifiable PMHNP license. Medicaid enrollment is a plus in the state where you practice, as well as the state of residence. If it is not Illinois, at least 2 years experience, ideally in addiction or mental health treatment. We will consider relevant previous experience for those with less than 2 years experience as a PMHNP. Experience prescribing Suboxone and active DEA registration. Willing to obtain additional multi-licensure, as well as empathy for members facing behavioral health challenges and comfort using technology, including EHRs, that is electronic health records, and mobile apps. The same for the Idaho position. This one has the exact same requirements. And for the one in Indiana, this is also full-time, part-time in Indiana, and the exact same requirements. Blue Cross Blue Shield of South Carolina is hiring an RN medical reviewer too. This job is full-time. This job requires you the ability to obtain security clearance, which requires applicants to be a U.S. citizen. You'll work from 8 to 5 the weekdays, and may be necessary to give the business need to work occasional overtime. You must have an associate's degree in the job-related field, graduate of accredited school of nursing, 2 years clinical experience, working knowledge of word processing software, that's Microsoft Office, Microsoft Word, ability to work independently, prioritize effectively, and make sound decisions. I'm going to skip some of these bullet points. They want active RN licensure, in-state hired, or active compact multi-state RN license as defined by the NLC. Unity Point Health is hiring for a RN call center. This job is full-time. Your shift will be 10:30 p.m. to 7 a.m. This is an overnight job. You also work every other weekend, holiday rotation, and you must reside in a compact licensed state. You must have an active unrestricted license to practice nursing in the states of Iowa and Illinois, at least 1 to 2 years of clinical nursing experience providing direct patient care or equivalent work experience, 2 to 3 years preferred, strong time management and organizational skills. I'm going to skip some of these bullet points, but do make sure you have Microsoft Office on your resume, as well as any electronic health systems, electronic health records, electronic health medical records. And they do prefer a BSN, but this is not required, and also compliance with mandatory child or adult abuse reporting. TriWest Health is hiring for a care coordinator RN. This job offers remote opportunities for several states. I'm going to zoom in here. And you can pause to read. Also, veterans, reservists, guardsmen, and military family members are encouraged to apply. You must be an RN with a current unrestricted license in appropriate state or territory of the US, 2 years experience in clinical nursing experience, proficiency in medical data entry, written skills in Microsoft Office, exceptional oral communication skills, strong organizational skills, and easily adapt to change. They also request you to be able to work any shift, work within standard office environment, or work from home, and extensive computer work with prolonged sitting. And the salary for this job is $83,000 to $88,000 per year.